Okay. Welcome everyone. Thank you for joining us for today's Che Alaska webinar. My name is Sarah. I'm the communications coordinator with Alaska Community Action on Toxics. And today we're going to be talking about PFAS in locally caught fish and how this is a threat to both health and to environmental justice. But before I get started and introduce our speakers, I want to note that Che Alaska is a program of the Collaborative for Health and the Environment and ACAT, and it's also part of Che's broader international coalition of over 5,000 individuals across the globe. Before we start with the presentations, I'll also note that during the presentations, we'll have the chat box disabled, but if you have any questions, please feel free to send them in the Q&A box at the bottom of the screen at any point, and then we'll get to as many questions as we can after the presentations. And I'll go ahead and introduce our amazing speakers today. We have Dr. Tasha Stoiber, who's a senior scientist at the Environmental Working Group, and she'll be talking about a recent study that she co-authored that found substantially higher PFAS levels in locally caught freshwater fish. And we'll also be joined by Dr. Samaris Seguino Medina. She's the Environmental Health Director at ACAT, and she'll be presenting on behalf of Pamela Miller, as she was not able to join us today. But we're so happy to have you, Sama, and thank you both so much for being here. And without further ado, I'll pass it over to Dr. Stoiber to get us started.
Great. Thank you, Sarah, for the introduction, and thank you to Che Alaska for the invitation to speak. Of course, recently there has been a lot of attention paid to drinking water contamination with PFAS, but it's also important to consider and give a closer look to the environmental contamination that might affect dietary sources of exposure, like freshwater fish. So for today's talk, I will be sharing highlights from our recent publication that was released last year in January, looking at fish as a source of dietary exposure. And this publication received a fair amount of media attention, I think because of the potential health and economic impacts of these findings. And if we have time, I'll briefly share about our PFAS and Wildlife Map project and another publication that was released along with that map last fall. And to briefly introduce our nonprofit, the Environmental Working Group, our mission is to empower people through breakthrough research to make informed choices to live a healthier life in a healthy environment. And the goal of our work is to drive and inspire change and to build public sentiment for action when there's a lack of regulation that's needed to protect people from chemical exposures. And our peer-reviewed research projects are the scientific basis for driving this change. We translate science and educate to support new policies and to protect public health. So of course, PFAS, our per and poly-fluoroalkyl substances. This is the huge family of highly fluorinated chemicals that all have that characteristic carbon and fluorine bond. They build up in our bodies, they build up in the environment, and they don't break down once they are out into the environment. That's why they are sometimes known as the forever chemicals. They're highly toxic at extremely low levels. And I think with the mounting research actions by companies, product bans and other actions by states and educational campaigns, I think PFAS is starting to become more of a household word. And I think more people are worried about exposures and they want to know what to do. EWG has been working on the issue of PFAS contamination in drinking water and in consumer products for over 20 years, since the first drinking water contamination was discovered outside of Parkersburg, West Virginia, near the Washington Works DuPont manufacturing plant. And the more research that has been conducted in this area, the more that we're finding that these chemicals are even more toxic than previously thought. And the more places that we test for them, the more that we're finding them. We've been working to uncover the industry's deceptive strategies to downplay the health harms and mislead the public. And the industry has known that these chemicals can build up on our bodies since as far back as the 1950s. And industry scientists, studies have shown decades ago that they knew that there were potential serious health effects that could result from these exposures. And these decades of unregulated releases have led to widespread contamination with consequences like contaminated drinking water and contaminated wildlife. So in our publication, out in Environmental Research in January 2023, we analyzed EPA's national fish testing data from two programs, from the Great Lakes Fish Tissue Study and from the National Rivers and Streams Assessment. And what we found from these two data sets that PFAS are widely detected in freshwater fish across the United States. The data sets that were available at the time were from 2013 to 2015, and there's since been another data set published. But that is the data set that we analyzed. And what we found in even considering conservative estimates of the median amount of PFAS in fish, that even infrequent consumption of freshwater fish can significantly increase levels of PFAS in your body. And then this can be equivalent to drinking contaminated drinking water that's moderately contaminated for over a month. And another startling finding was that there's a lack of consistent fish consumption advice for how to safely eat fish in the US, or even absent in a lot of states in the US. So based on the EPA's 2013 to 2015 data, and considering the calculated median for PFOS from these data sets, we use a consumption model to estimate increases in PFAS from eating fish. In the model, we assumed 100% absorption from eating the fish based on other references for animal feeding studies. We assumed no PFAS was lost through cooking, and that consumption results from additional exposure on top of baseline. And based on these model estimates, as few as 4 meals per year could double the levels of PFOS in the blood. And this is based on considering a baseline amount of PFOS in the general population's blood from the CDC's NHANES biomonitoring program of a representative population in the United States. So for those that consume freshwater fish, even to a low degree, this dietary source can be a significant source of exposure. And this is a map of the concentration ranges showing where PFAS was detected across the United States. Streams in the study were selected to be a representative sampling, and sample sites, there were about 30 sites sampled on each of the Great Lakes. And you can see the darker dots represent the higher concentration ranges. And some of the higher levels found in fish were up to a handful were measured at about 200,000 parts per trillion. Those were some of the higher concentration ranges, and where we observed that there were higher levels in the fish tended to track with higher population areas. So that makes sense given that higher populated areas or urban areas, there's going to be more potential sources for freshwater contamination. So those observations made sense in terms of potential sources for contamination in those areas. And Great Lakes medians tended to be slightly higher compared to the streams and rivers, possibly due to higher retention times in the Great Lakes. And from the two EPA monitoring programs, there were 500 composite samples, fish samples with detections, and only one sample had a non-detection, and that was a sample from a somewhat remote river in Central Oregon. I had to go back and look that one up. And across all of the fish samples, there were nearly 75% of the total PFAS measured was PFOS. That constituted the largest percentage of total PFAS, with other longer chain PFAS, PFUNDA, about 10%, and PFDA, nearly 7%, with the median total PFAS at about 12,000 parts per trillion. And there were 44 species total that were sampled between the two studies, and there were wide ranges of concentrations within the species. And considering this contaminant, considering how PFAS builds up in fish, it doesn't follow trends like other contaminants like mercury, for example, where species on the lower end of the food chain or smaller fish might accumulate smaller amounts. That's not the case for PFAS. And that's definitely an area for more research to understand that, because smaller fish can also accumulate large amounts of PFAS. So there's no clear trends there. And some of the more frequently eaten fish were sampled a little bit more heavily in the programs: smallmouth bass, largemouth bass, catfish, and walleye. And again, considering the median level of PFOS in the fish samples, and how frequently a person consumes this fish, this can be, of course, as another example of how frequently you might eat fish, whether it's 1 meal a year, 4 meals a year, 1 meal a month, or 1 meal a week. For those that are consuming high amounts, for example, 1 meal a week, that could increase over that baseline level, that median background level, up to 10 times. And if you eat 1 meal a month, for example, that could increase your blood levels by 3 times. So considering frequent fish eating populations, this could be your number one source of exposure, depending on how frequently you might eat freshwater fish. And we can also think about this exposure in terms of equating the amount in an 8-ounce serving of fish. Calculated to what the equivalent amount of would be in drinking water. So you can make the assumption of drinking about 40 liters of water per month, and then calculate what would be that level of contamination in drinking water that would give you the same exposure. So considering that the median PFAS calculated from this data set, that would be equal to drinking 1 month of drinking water at about 48 parts per trillion for PFAS. And this level is about 2,000 times over the EPA's health advisory level, and also, for reference, about 10 times over the proposed MCL for PFOS. So just thinking about it with respect to drinking water contamination also gives some context and some perspective. And compared to other biomonitoring studies of high-frequency fish consumers, there are a couple studies that were done in New York State that looked at communities that relied on freshwater fish for food sources. And these modeled results were in line with what was observed in these biomonitoring studies, where some of the high-frequency fish consumers had about 10 times the level of PFOS in their blood compared to the general population. And actually, the modeled results were quite conservative, considering from that study, some of the participants that were on the higher end in the 90th percentile, their blood levels were actually much higher. So the modeled results were in line with what was actually observed in some of these high consumption populations. And we also compared the freshwater fish data to the FDA's seafood sampled from their total diet study. And we found that grocery store fish had much lower levels of PFAS. And this could be due to several reasons. Some of the samples were marine species, or some of the samples could be like tilapia, for example, could be farm-raised grown fish that are grown in a controlled environment. So this really shows just how vulnerable the freshwater surface waters are to contamination. And another finding was this lack of consistent guidance with how much fish can be safely eaten. There are 17 states that do have guidance for PFAS in fish, but these are mostly just specific to PFOS. And these guidance levels are most often based on the EPA's lifetime health advisory reference dose. And if those guidance levels were updated to reflect the 2022 lifetime health advisory reference dose, most of the fish in the study would be not safe to eat. So that finding was also pretty eye-opening. Alaska specifically does not have statewide consumption guidelines, but there are several do not eat guidelines for two specific lake areas. And I believe the next speaker is going to talk more specifically about Alaska. And also there is a state monitoring program that has found lower levels in fish, but I believe that this state sampling program, I believe the fish weren't specifically sampled in higher contaminated areas. So looking forward to hearing more about Alaska specifically. And in summary, so the findings from this study, so nearly all of the fish sampled in the US through these two EPA programs had PFAS contamination. And as I mentioned earlier, it speaks to just how vulnerable surface waters are to PFAS contamination, and how that consequences are essentially contaminated fisheries and a contaminated food source. And another startling finding was that fish, even infrequent amounts of fish consumption, can significantly increase your exposure. And so people that rely on fish or self-caught fish for calories or a protein source, they're going to be the ones that are disproportionately affected. Solution might be to purchase fish at the grocery store, since those fish tended to have much lower levels in comparison. But however, this isn't going to fit in everyone's budget. And so this really points to the need for national fish consumption advisories and an awareness that's really important, especially for those high fish consumers. And there were some hopeful data trends in comparing this data set to the previous data set that was collected 5 years prior. We did note that PFOS levels were about, that median level was about 30% less. So that is a hopeful trend that was observed. Of course, there are no easy answers here, but hopefully that there are steps that can be taken for long-term improvement. And if I have time, please stop me if I'm going over. I was just going to briefly mention our other PFAS and wildlife project, where we mapped studies where scientists have measured PFAS in wildlife on a global scale. This is not a comprehensive listing of all of the studies, but just a subset of over 250 peer-reviewed studies of recent work where scientists have measured PFAS in various wildlife, over 625 species that are mapped in various study locations. And this includes mammals, fish, birds, reptiles, as well as that EPA data set is also included on this wildlife map. And threatened and endangered species are also indicated on the map as well. And there's also a peer-reviewed discussion paper published in the Science of the Total Environment, along with the map release, that looked at health effects of PFAS exposure in wildlife. And many of the health effects that we have epidemiological studies and where there's high certainty and strong evidence, things that we've noted in human studies, like impacts on the immune system, impacts on the liver, disruptive hormones. What we found in the few studies that we have in wildlife was that there are these shared effects that are noted in humans as well as animals. So I'll just summarize really quickly. Human health and wildlife are connected. What we know about the impacts that PFAS have on humans can also help protect animals. We face similar exposures, and now that we're finding with the few studies that we have in animals as well that have similar health impacts. There's widespread contamination in both fish and wildlife on a global scale from PFAS. And this really speaks to the urgency to phase out those non-essential uses of PFAS, and controlling pollution and preventing future discharges will be essential to protect public health along with animals. And it also speaks to the need for assessing and remediating the current PFAS contamination that we have right now. And I will try to end on a positive note too, that we are seeing some actions. Of course, companies are starting to take PFAS out of products and clothing, cookware. We're starting to see a lot of states pass bans and get PFAS out of things like textiles, cosmetics, children's products, food packaging. And we're also seeing the EPA's first MCL drinking water proposed standards. Those have come out and hopefully will be finalized soon. So that these actions have been a long time coming, and of course there's so much more to do, but glad to see that there are some steps being taken. And I will end there. Thank you.
Thank you for that great presentation, Dr. Stoiber. We really appreciate your work on this issue. And as you said, yeah, there's some growing awareness around PFAS in drinking water, but I want to emphasize what you said about the lack of consistent federal guidance on how much fish can be safely eaten. But I won't say too much on this because we'll be hearing more about this soon. But thank you, and I will now pass it over to our speaker, Dr. Sama Seguino Medina. She's the Environmental Health Director at ACAT, and she'll be discussing more about PFAS contamination and environmental justice specific to Alaska. So Sama, thank you for being here.
Thank you, Sarah, and thank you, Dr. Stoiber, for your presentation. Yes, I'm going to share my screen here. 1 second. Let me know when you can see it. Yeah, perfect. Buenos días, good morning. My name is Amaris Seguinot Medina. I'm Boricua, living and working in Denaina lands, also known as Anchorage, Alaska. Today is -20, so it's a little bit chilly here. And I share regards from our executive director, Pamela Miller. She's at the moment doing biomonitoring and community-based participatory research work in the Bering Sea, in the native village of Gamble. So I'll be sharing her presentation about the work we're doing with communities around Alaska as part of our work. Our mission is that we believe that everyone has the right for clean air, clean water, and toxic-free food. And we're an environmental health and justice nonprofit based here in Alaska. So I'm gonna go over kind of quick in some of the slides because Dr. Stoiber kind of share some of these details about PFAS and where it's found. As she said, they were developed in the 40s. It includes more than 12,000 compounds. They were developed for commercial industrial use. They resist heat, oil, and water, and that's why they're called forever chemicals. They're very resistant to environmental degradation and very persistent. PFAS is bioaccumulative and it's toxic. We can find it in many consumer products, including non-stick cookware, food packaging, waterproof clothing and gear, stain-resistant furniture and carpeting, and other personal care products, including children's products. PFAS is also found in a type of firefighting foam known as aqueous film forming foam, and the acronym for that is AFFF. And this is used in airports, military installations, oil and gas facilities, fire training centers, and other locations to extinguish petroleum and flammable liquids fires. So in Alaska, the road system only takes you as far as it can, right? Alaska is a vast state with a lot of natural spaces still. And a lot of the communities in Alaska are in remote locations without road access. So to many of these locations, people travel by small plane. So there's many airports, small airports throughout Alaska that uses AFFF. Unlike many other states, like our previous presenter shared, with PFAS-related fish consumption advisories, Alaska lacks regulation and health guidelines for PFAS contamination, which is, as you can see now, with the evidence of high concern. Several lakes in Alaska have fish consumption warnings due to PFAS contamination from firefighting foam. And PFAS exposure is a significant issue in Alaska, due not only AFFF and the consumer products, but also due to atmospheric transport and ocean currents carrying pollutants from all over the world to the Arctic. Sources of drinking water contamination from PFAS, like I mentioned, AFFF, production facilities, waste disposal facilities and sites, wastewater, and other industries. And then how are we exposed? And we already talked about this a little bit. So we're exposed to drinking contaminated water through food that's been contaminated by PFAS, direct contact with products that leach out the chemical, household dust, air, from mother to the baby in the womb, breast milk, and infant formula. And then I just wanted to share a little diagram of how different ways that we are exposed. Some of the health effects, and there's overwhelming evidence supporting these health effects due to PFAS exposure. There's growing evidence of cancer, different types of cancer, heart disease, different types of heart disease and conditions, birth defects, liver disease, decreased immunity. And I wanted to add this statement: rural and indigenous communities relying on freshwater fish as part of their traditional diet and culture may be at higher risk from these serious health threats. And here in Alaska, we are highly dependent on subsistence and traditional fishing, salmon, halibut, and many other fish. So this is especially important for the people here in Alaska. I see that we share an important image that Dr. Stoiber also shared in her presentation, but it's good to look at it again, I think, because it shows what are the health conditions that have high certainty according to the scientific studies linked to PFAS exposure. And we have developmental effects affecting the unborn child, and we wanted to emphasize that because women are the first environment of all of us, of children. And we see a lot of strong, serious health effects to the unborn child. And then also, not only the woman, the male suffer from many of these health effects like thyroid disease, increased cholesterol levels, liver damage, kidney cancer, testicular cancer. We've seen a few cases of testicular cancer and a possible association to PFAS exposure here in Alaska. So really concerning. So this image is in Kimberly Lake, Fairbanks. And it reads the sign on the top: catch and release fishing only due to PFAS contamination. All fish caught must be released immediately. And then there's some other caution signs. It's sad that I didn't have available right away the picture of what's behind this sign. And what's behind it is, this is when I think that common sense is not that common. There's a wooden rack with PFDs, personal floating devices for children, that are hanging there right next to the entrance of the lake, a beautiful, clear water, beautiful lake. And they have PFDs for children, so children can get in the water with their PFDs to enjoy the water with PFAS contamination in them. A lot of children get in that water and play and get covered with it and drink of it. So this is an environmental injustice issue. PFAS contamination in freshwater fish is an environmental justice issue for many communities that depend on locally caught fish for sustenance and traditional cultural practices. In 2019, we at ACAT decided to create a report because we realized that this was a big issue. And there was no information for the public and legislators to learn about this issue in drinking water. So we published this report, Threats to Drinking Water and Public Health in Alaska, the scope of the PFAS problem, consequences of regulatory inaction, and recommendations. We wanted to share this with state and federal policymakers so they can make informed decisions to protect current and future generations from continued exposures to the PFAS class of chemicals, which are more than 12,000. The information presented here in this report was obtained looking at hundreds of documents, review of peer-reviewed scientific literature, documents obtained through public records requests, and also interviews with scientists and agency personnel. It was highly controversial when it came out, and it was in the news for a little while. And these are some of the main things that we discover with this report, and then another report that I'm gonna be sharing with you. In 2019, when we did this report, we found 100 individual sites contaminated with AFFF in nearly 30 locations. Now, currently, there are 469 sites in Alaska where PFAS contamination has been identified in soil and water. And this is according to Alaska Department of Environmental Conservation. Communities throughout Alaska have unsafe levels of PFAS in drinking water. Lakes close to fishing include Kimberly Lake, Bear, Moose, and Polaris Lake, Bathing Beauty Pond, Pile Driver Slough, and Moose Creek. All of those in the Fairbanks borough area. We also work, in Anchorage, we work in Fairbanks. We've done PFAS testing in humans at a request of tribal governments of the island of Sibuca, which are partners of ECA for more than 20 years. Native Village of Samunga, Native Village of Gambo leadership asked for us to test PFAS. Now, it was almost 8 years ago in reproductive age men and women. And we also found PFAS in people in the Arctic, specifically in the Bering Sea, Yupik Siberian communities. But this paper was from Southeast Alaska, a community called Gustavus. And we were able to publish articles about all of this that I'm mentioning, also the work we do in Sibucac, PFAS in drinking water and serum of the people in Gustavus. And it was very sad to see a community that was working towards being sustainable, doing organic gardening, raising organic chickens and other animals that are part of the traditional diet of the communities, the water coming out of the faucet from their homes and school, all contaminated with PFAS. A paradise just completely polluted with this chemical. We did a publication about it, and it was in the news also. We published in Environmental Pollution Journal. And this was a collaboration between ACAD researchers, Gustavus PFAS Action Coalition, and Indiana University. Key findings of this report, we found 14 distinct PFAS in Gustavus water samples and 17 different PFAS in serum of people. PFOS and PFHXS were the most abundant PFAS in both water and serum samples. We also found that contaminated drinking water from private wells contributes to overall PFAS body burden in Gustavus residents. Then we did this. We decided, because people were concerned. So in Anchorage and Fairbanks, people wanted their water to be tested. And after we did community testing, we did this report, Alaska Community Water Quality Report, PFAS contamination of Municipality of Anchorage and Fairbanks North Star Borough waters. In this report, conducted independent water quality testing in 2022, show PFAS contamination in Anchorage lakes as well as in Sheep Creek, which is a creek that runs through the city of Anchorage. These results show contamination in lakes used for swimming and fishing here in the city. The results also show contamination in Sheep Creek downstream from Joint Base Elmendorf and Fort Richardson, also known as J-Bear, an important urban ecosystem for fish, wildlife, as well as fishing. The samples from 2021 and 2022 reveal the presence of PFAS chemicals in all the water bodies we tested in both Anchorage and Fairbanks North Star Borough. This data emphasize the need, like it was mentioned before, for urgent action to protect public health as well as wildlife. The data concerning PFAS in our local lakes are concerned to environmental and public health, and the information is a public right to know issue. A lot of these communities and governments and local governments are struggling because they don't have the information to start with. And that's why we are trying to bring all the information and science accessible to them so they can make informed decisions about how to deal with this issue and how to promote legislation that is protective of communities and communities' water source. Other results from this report of Anchorage and Fairbanks waters, our sampling analysis revealed PFAS levels in Anchorage lakes ranging from 10.2 parts per trillion, that was in Sunday Lake, to 952.2 parts per trillion in Lake Spinard. Lake Spinard is a place surrounded by community, and a lot of people, children, dogs, wildlife, fishing happens there. In the Fairbanks North Star Borough, levels range from 2.8 parts per trillion in Belen Lake to 179.4 parts per trillion in Airport Lake. Concentrations in Sheep Creek range from 4.3 parts per trillion to 32 parts per trillion. Levels of PFAS in Anchorage Lakes and Sheep Creek are similar, and this is something that I want to emphasize, to those that trigger fish consumption advisories by the Alaska Department of Fish and Game for certain lakes in Fairbanks North Star Borough. Levels of PFAS in fish can be several orders of magnitude higher than the ambient water because many PFAS are strongly bioaccumulative. So these are concerning results. This is a table just to show, just to pay attention to the second column in Lake Hood and Lake Spinnard. Worrisome levels, high levels of PFAS. And other PFOS and PFOA, other congeners of the class of chemicals. So this prompted action. We decided to work with the legislature and ask that they take action. The Alaska legislation work as a bipartisan manner. And last year, after a lot of education and dialogue and sharing knowledge and scientific evidence, in May of 2023, House Bill 51 was passed. Legislation that will have been a significant step toward preventing further water contamination from dangerous per and poly-fluoroalkyl PFAS chemicals across the state. The vote was amazing. It was an amazing experience because it was almost unanimous. 58 of 60 members of the Alaska House and Senate worked across party lines to pass this bill. The governor vetoed pen, brought progress on PFAS to an abrupt halt. So the governor vetoed it. And then we decided to call on legislators to use their power to override the governor's veto of HB 51 to continue the work toward passing comprehensive legislation and needed legislation to address the huge PFAS problem in our state and protect the health of people. We also support the passage of SB, Senate Bill 67, also unanimously passed by the Senate and transmitted to the House, and strongly advocate for SB 67 be further strengthened to include the following. And these are some images from the news, but these are some of the things that we are asking the Alaska legislature to consider and include in the continued struggle of passing PFAS legislation in Alaska to protect water, wildlife, and human health. We ask the Alaska state legislature to enact legislation this session to protect our waters and public health, including provisions that create health protective enforceable drinking water standards to reflect current science. And there's a lot of it, as you saw from Dr. Stoiber's presentation. Provisions to phase out PFAS in firefighting foam should be modeled after laws passed in Washington, Colorado, and California. No exemption should be allowed for the oil and gas industry, and safe and economical alternatives are available and in use right now in the US and the world. Provide safe drinking water sources for affected communities. Should be a priority. Pass comprehensive legislation to phase out uses of PFAS, including food packaging, textiles, cosmetics, and other non-essential uses. And there's other states that we can model this, like Minnesota and Maine, who have amazing legislation passed. No incineration of PFAS waste should be permitted. Incineration is a false solution, so it's something that we should avoid. It does not destroy PFAS and results in air contamination and wider exposure to communities that are already overburdened by pollution. New York and Illinois have banned incineration as part of their bills against PFAS. Also, we want to include provisions for comprehensive monitoring of surface and groundwaters, fish, wildlife, and garden produce. We wanted to share that Minnesota passed a bill in May of 2023 called Amara's Law that will ban the sale of non-essential uses of PFAS containing products from 13 categories, including menstrual products, cookware, children's goods, and firefighting foam. And the last of the provisions that we asked the Alaska legislature is place financial responsibility on large industries that are directly or indirectly linked to PFAS pollution to cover the cost of cleanup, assistance for communities, and water utilities affected by PFAS contamination. And to end, so we have time for questions, I want to share some statements. One from our executive director, Pamela Miller. And this is something that she also was quoted in the news. Alaska is lagging behind other states that are leading the way in enacting legislation to protect the health of their residents and prevent further harm from exposure to PFAS. The legislature has the authority and moral imperative, I completely agree, to act now in addressing PFAS during this legislative session. We also have a quote from a resident of Fairbanks. This image is from Pile Driver Slough in Fairbanks. And the quote says, "Our family loves to fish. We used to fish in Pile Driver Slough, the beautiful stream near Fairbanks." These are words from Patrice Lee, a mother and teacher in Fairbanks and also an environmental activist. "We have such wonderful memories of fishing there throughout the summer. It is heartbreaking that we can no longer fish this stream and other lakes in our area because of the PFAS contamination. It is time for our legislators to enact legislation to address PFAS as an urgent public health issue." And then I wanted to share some resources, and at the end of the presentation of Dr. Stoiber, she shared some things related to this. We are partners with this national coalition called Safer States. Part of one of their colleagues and campaigns is Mind the Store, which is a shift in the market and putting pressure to some of the bigger players having products with PFAS, take measures as companies of removing PFAS from their products. So just wanted to share this PFAS policy toolkit. You can find it in the Safer States website. It's very helpful if you want to learn more on how to get organized and what other states are doing in terms of legislation at different levels. And then I included a map just to show, and this is from the Safer States website. They have a new beautiful website. Policies for addressing PFAS. There's 31 states right now that have introduced 225 policies to protect people from toxic chemicals, PFAS specifically, and 139 state policies that have been adopted in 29 states. So the states are taking action, and we hope that federal action continues to work towards protecting and assuring that the people's health is first. So thank you so much. I'm gonna stop there. This is our website. We believe that together we're stronger, and it's great to collaborate with many scientists from organizations like EWG and many university partners and tribal leaders and villages across and communities across Alaska. My name is Sama, and thank you so much.
Thank you, Sama. These are super important issues in environmental health, and we're really happy to have you share them. And like you said, a very big issue of it's a right to know issue. I think now we'll go into the Q&A. We have about 10 minutes left. I see there are a couple questions from the audience that we have. This one's for Dr. Stoiber, and I think Sama, you could also comment on it. Dr. Stoiber, could you comment further on the prospects for providing alerts in multiple languages to anglers?
Yeah, I think that's an extremely important point to raise, to make sure that all of the information is accessible to the people that are affected the most by it. So I think literally translating that science to make sure that people understand it, to make sure that they understand those risks and that those risks exist, that is going to be really, really important. Of course, it's difficult because you can't tell people not to eat fish, or you can't tell people not to fish, but it's really important to get that information out there in a way that the science is accessible, and that people understand that this is a potential source of exposure. This is what it might mean for your health. So it's just a really important point to make sure that it is in the languages in the region, and the specific communities are understanding what the case is, and how eating that locally caught fish might affect them. So that's a really important question.
Thank you, Dr. Stoiber. I wanted to share also science translation so people can actually use the information and understand it, but also translation into languages. We are trying to translate the work we do in Spanish as well, English and Spanish, and also as part of another project that we have working with breast cancer prevention, we are translating a PFAS fact card into Yupik, which is the Alaska Native languages that's mostly spoken here in Alaska. So super important. Thank you.
Yes, thank you for that. Another question that we have from an anonymous attendee. Since most people aren't exposed to high levels of PFOS through their drinking water and have little control over it if they do, have you ever thought of comparing fish tissue concentrations to products such as lip gloss, other types of personal care products? Those are exposures that can be controlled. Maybe you could talk about how those types of exposures compare to each other.
Yeah, I think we definitely need to understand more about the sources of exposure from PFAS. Exposure is going to depend on, of course, where you're at in your life stage, where you're located, and different types of PFAS are going to be in different exposure media. So it depends, for example, PFOS accumulates in high levels in fish and meat. And if you think about all of the different sources of exposure in your home, for example, if you are a small child and you have carpeting in your home, and your child is on the floor a lot and putting your hands to your mouth, dust and PFAS that has shed from carpeting and other textiles in your home that's deposited in that dust, that can be a #1 exposure route for a small child. If you're a person that lives in a highly contaminated area, near an area, as we heard about, an area that's been heavily contaminated with AFFF firefighting foam, if there's high levels in the drinking water, that might be your #1 exposure. Or if you actually work in the industry. So it depends on, exposures are going to depend on where you're at in your life stage, where you are at, where you live a lot of the time. And in terms of drinking water too, one of the things that you can do is filter your drinking water. As we've seen, even low levels of PFAS exposure can have effects on your health. So we do recommend that people filter their drinking water, carbon filters, reverse osmosis filters, effectively remove PFAS or reduce PFAS from your drinking water, and it can make a big difference. So that's something that we do recommend. Sama, if you have additional comments there.
Oh, I think that was a perfect answer. Thank you.
Yeah, thank you. I see another question. To what degree is PFAS expected or normal, since all water bodies, I think you mentioned in your presentation, Tasha, all water bodies in the US have some detectable levels? And is it possible that PFOS levels are declining and the contaminated water bodies are accumulated and retaining the chemicals?
Yeah, that's another good question, and I did mention this briefly. There was after this paper was published, there was another data set, a 2018 and 2019 data set that was released just after our paper was published. And we are seeing those trends where the PFOS median is slightly declining over time. PFOS, of course, was voluntarily phased out, a number of years ago by industry, but of course, we do have all of the other replacement PFAS that are now becoming available and also being used in its place. And so what we are seeing is that PFOS over time is going down in people's blood, and that we also observe this in the fish tissue data that it is slightly going down. So it shows that of course, there is still a lot of legacy pollution out there, and there's a lot to be done about that. But it does show that over time that it can decrease. And that's why it's really important to think about this class of chemicals as a whole class of chemicals and not think that the other replacements are going to be a good idea because they have similar health effects. But what we're seeing is that PFOS, it is slightly going down over time in people's blood. And that's also what the fish data showed too, that it was slightly decreasing. And so I'll stop there. Sama, if you have other additional comments there.
No additional comments. I just wanted to say I'm adding in the chat some of the papers where we've done PFAS sampling in. I forgot to mention that we've also done PFAS sampling in traditional subsistence foods here in Alaska, from remote areas, actually from the island that Pam is right now, Sibukak Island. We tested a whale, seal, in other traditional foods. So anyway, I'm sharing those for people that are interested in reading more.
Thank you for sharing that resource. Maybe as a last couple of questions, I think we talked a lot about how it's largely on policymakers to curb the PFAS contamination and our exposure to it. But are there safe, effective substitutes for PFAS, or do we have to learn to do without, maybe for the uses of PFAS?
Yeah, that's a good question. And of course, people are so ubiquitously exposed through all of these different products and all of these different ways that it is impossible to avoid all exposure, but there are things that you can do to reduce it somewhat. In terms of substitutes, for example, there are non-fluorine formulations of AFFF foam now, for example, and other outdoor goods and sporting goods. There are now companies that have committed to not using PFAS in those products as well. So, and I think building public awareness, and the more that people learn about this, and that the more that they, push for companies to get PFAS out of products, the better. A lot of times it's not needed. It's been used as, it's a marketing. It's a way to sell. It's a marketing tool. It's a way to sell things. And a lot of times it's just not needed in so many of these different products. So if you look for things that are not marketed as non-stick, as wrinkle-free, or waterproof, or stain-resistant, things like that, if you try to avoid some of those types of things, those are some of the products that do tend to have PFAS in them. So you can, check with companies that have made commitments and look for products that don't have those kinds of labels on them. Those are some of the things that you can do, but really it is going to be top level down, stronger policies and regulations that are going to be needed to be put in place to protect people the most. And Sama, I'll pass to you if you have additional comments.
Yeah, I agree. Those are great comments and closing comments. So yeah, many alternatives in many places. I know SeaTac, International Airport in Washington, is using alternatives. Also California is looking into using alternatives, London, Australia. There's many places right now that are successfully, they've been using alternatives to PFAS. And then the marketing part, like Dr. Stoiber said, you know, we've been partnering with Mind the Store campaign and asking REI as consumers to please phase out PFAS and take out PFAS of their products. I know that Patagonia, Keen, the boots, hiking boots maker in Patagonia, are also committed to phasing out. McDonald's is making an effort, BK, Burger King also. So a lot of industries are listening to the consumers and paying attention. And then legislation, we need to put pressure to our politicians to make the right laws more protective of people. Anyway, thank you so much for sharing space. I really appreciate it.
Yes, thank you guys. I think that's all the questions we have time for, but thanks to everyone for tuning in and for sending in your comments and your questions. And of course, thank you to the panelists both so much for being here and for taking part in this conversation. There was a question about a recording of this webinar, which will be available through the ACAT website. And you will also all receive an email fairly soon with the recording. But thank you all both so much for being here, and we'll see you next time for our next Alaska webinar.